We are continuing our lecture looking at medicine through the ages, found in chapter 1, pharmacy and healthcare. And we have already touched base on the different type of individuals who had a significant role in Western medicine, such as Paracelsus, the Indians of Mexico, Le Xing, the Jesuit priest, which brought back quinine from the quote New World, Dr. Z.D.L. Bolston, William Witherin, Edward Jenner, that you should definitely be familiar with, in that he designed the first successful vaccine. Frederick Sir Tumor, Louis Pasteur, another one that you should definitely know. And we will continue to talk about Karl Kohler at this particular point in time. He developed the first local anesthetics, and which was involved with eye surgery, and he used cocaine. Remember, we talked about the Indians of the Indies in South America using the coca leaf as an anesthetic. He was able to find the active ingredient of the coca leaf and use it as a local anesthetic. 1890, antitoxins came into play for diphtheria and tetanus. We already talked about salicylic acid and beer aspirin. If you are familiar with that, came around in the late 1800s and still used today. And remember, aspirin is coming from the bark of the willow tree. These days, they're made synthetically. You should also be familiar with this famous experiment, Banton. I believe was a professor in medical school. Bess was a student. During a summer project, they recognized that the hormone insulin was very important in lowering blood sugar, and so Banton and Bess was very important in that the discovery of insulin allows for the treatment of individuals who suffer from type 1 rather, diabetes. One of the most significant development was by Alexander Fleming in 1928, in which he won the Nobel Prize for. He was not the most neat microbiologist, and so he left a window open, and one of his agar plates was open. And when he came back, he observed that it was killing bacteria, fungi, and that fungi became known as penicillin, which became the first antibiotic drugs. And some people feel that this particular drug was very helpful in winning World War II for the Allies. In 1943, a hormone progesterone was discovered. It became the first birth control. It came from the Mexican yam. Another person that you should definitely know is Watson and Crick, and those particular individuals that have made important and say you need to know. You may find that in your licensing exam. Watson and Crick was very important to, in that they identified the structure of DNA, and because we understand that the structure, genomics came about later on. I was able to meet James Watson, and Francis Crick died a while back. 1955, Jonas Salk created his vaccine, and 1957, Sabin developed an oral polio vaccine. And basically, it is a live attenuated vaccine, and the industry had been moving away from live attenuated anything for vaccine development. So Salk refined an injectable polio vaccine from a kill polio virus. And then Sabin did the same, creating a oral polio vaccine. And polio may be the next disease eliminated from the face of the earth. 1960, the birth control pill was introduced. 1981, very significant date, AIDS was identified. AZT became the first approved drug for the treatment of AIDS in 1987. I remember when they talked about the sequencing of the human genome. That particular project started in 1988 and concluded the sequencing of the human genome, all 3.2 billion nucleotides, and that allowed for the development of the modern genomic industry and the modern biotechnology industry. Amgen was one of the first companies that was very successful in utilizing the genomic information to create their blockbuster drug. The first being Epigen, which is still used today to treat anemia, treatment for dialysis patients. Also, you should be familiar with HAART, which is highly active antiretroviral treatment. This is a combination of treatment. Basically, today, an individual can live an almost normal lifespan, even though they may have the HIV virus. Dilated sheep was cloned in 1966. Gardasil was the first preventable HPV vaccine and first vaccine targeted cancer. And then scientists in 2008 created artificial DNA molecules. And the innovations that are occurring today is totally tremendous. So this is just an overview of medicine through the ages. What you should be familiar with in relationship to the pharmacy, because that's what we're talking about. We are going to look at different aspects. One, dealing with prescription drugs, dealing with the pharmacist in general, dealing with the pharmacy setting in today's environment, and certain economical trends that makes being a pharmacy technician very, very useful. This is a degree that a high school student should have, and it will help them go through high school, pay the bills, but also add value to your graduate school application by showing that you have been in a healthcare setting, passed a national exam, and therefore are capable of completing dental school, medical school, etc. So let's look at pharmacy today and certain concepts that are associated with it. A prescription drug is one that has been ordered or prescribed by a physician or other individuals that are licensed to prescribe to treat a particular patient. However, because of the vast magnitude of drugs and available drugs, that different physicians are associated with. There's insurance companies that are also associated with the paying of these particular drugs. These particular factors make the area or using a very complex area for consumers. So the pharmacy technician plays a very important role in that regards. And the pharmacist start out as a person who just dispenses drugs, but because of the complexity of healthcare, there have been expanding responsibilities placed on the pharmacist, and thereby also placed on the pharmacy technician. And this expanding role is designed to meet the needs of the greater pharmacist, patient consultation, and sometimes even having direct medication administration services. So the pharmacist, just like the physician, is a trusted profession and also a very educated one at that. So just going back, a very quick review because this is very important to acknowledge. As we talked about the role of the community pharmacies coming up, and we also must talk about the complexity for consumers. So again, a prescription drug is one that has been ordered by or prescribed by a physician or other licensed prescribers to treat a patient. And because of the thousands of drugs that are out there, the different names, the different costs, the multiple prescriptions from different physicians, the involvement of insurers, these particular factors all together, as it relates to prescription drugs, make it a very complex area for consumers. Again, as reiterated, I must reiterate that the pharmacy and pharmacy technician can be very helpful in allowing consumers to navigate those particular fields. All right, the pharmacist. The pharmacy technician works under the pharmacist. The pharmacy technician assists the pharmacist within the pharmacy. And the pharmacist is one of the most trusted professions in the United States. And as mentioned, there has been an increasing role, and there are certain aspects of Congress that have increased the role of the pharmacist. For example, in 1990, the United States Congress required pharmacists to provide counseling service to Medicaid patients in the Omnibus Budget Reconciliation Act. And when we begin to talk about some of the legal aspects affecting the practice of pharmacy technician, we will also go over OBRA, which was passed by Congress in 1990. Also, in 2003, we have what's called the Medicare Modernization Act. Medicare was one of the programs that came about during the 1960s under President Johnson. Has played a very important role in increasing the health access to elderly individuals in the United States who don't have regular health insurance and complement health insurance. And this is called medication therapy management, and these are provided to Medicare patients. Okay, so when we talked about Medicare management, what we're talking about are services provided to patients with a comprehensive look at all of the medications they are taking rather than a consultation of only the prescription dispensed on a given day. And these particular type of developments have allowed for an expanded role of the pharmacist. So what are the pharmacist settings? Well, there are seven pharmacy settings that are very important that you should be familiar with. They are called the community pharmacy, and they are associated with CVS, Rite Aid, etc. And on the next section, which will be our fourth section, we will continue to talk about those particular pharmacy settings. But you should be familiar with some important aspects through medicine, to the ages, Hippocrates, Galen, Louis Pasteur, Jennings, Watson and Crick, and Banton and Best. These are important medicine giants that have made a significant contribution to westernized medicine.